Okay, Rachel, how's he doing?
Well, we're tachycardic at 135, we're hypotensive at about 70 over 40. I'm starting the first unit of blood and getting pressure in the meantime.
Right, okay, I need to get in this belly, open him up. Milena, I really need your full attention now. Okay, great. Michelle, I'm going to need loads of packs. I think he's got a belly full of blood. 9, great. 2 packs. Okay, keep it coming. All right, let's open this guy up. Okay, incision. Okay. Packs, give me packs.
Yeah.
Get more packs, Michelle. Okay. I think I'm getting control. How's he doing, Rachel?
Starting to improve.
Okay. I think I'm...
Heart rate's coming down to 125.
Great.
Pressure's starting to come up.
Great. Okay. Guys, I think he's going to make it. Okay? We just need to keep the pressure on right now. I want you to catch up with the blood loss, Rachel.
Yeah.
Okay.
Sandy, can you check if the next pack of blood is ready for the transfusion protocol? And the blood is continuing to go in on the level 1.
The Simulation Centre, in its simplest way, is a real hospital without real patients. Everything else is real.
Hi, John. I'm Patricia. I'm your nurse. I know you're in a lot of pain right now. Don't worry, I'll take care of that.
Whether it's the equipment that we're using, whether it's the space that we're using, whether it's the learners from medical students, nursing students, residents, faculty, everything else is real.
What happened?
I got hit by a car.
Okay.
In terms of the way that we run simulations here, you can broadly think about it in 3 groups. One is procedural skill simulations.
5 milligrams of morphine given. I'm just gonna take a quick look. Okay, Dr. Agarwal, I need you in trauma 1 stat.
The second part is patient-provider communication skills.
John, hi, my name's Raj, okay? I'm one of the doctors here. I'm here to look after you. I'm just going to put some cold jelly.
The third aspect is what we call team-based training. Best example is probably the operating room, where we have an anesthesiologist, we have a surgeon, we have nurses, and we work together in a team.
Right now he has 216 gauge, 1 in each antecubital. He has ringer lactates running.
We acquire the basic approach to communication with patients, to communication in the operating room, especially in crisis situations, and to lay the foundations for approach to clinical judgment, decision-making, and patient management.
John, you're going to go to sleep now. I'm going to start giving you some medications to go to sleep. Fentanyl's going in.
The Sim Center is an excellent environment, especially to be able to apply what we learn in theory into a simulation environment so that we can then bring what we learned to the real world.
It's a bit like flying a plane. You hope that the pilot would fly it well in the simulation.
It's a really state-of-the-art facility and that could provide the forum necessary for us to train and to develop our surgical skills and to reach the competency that we need so that we can become safe.
Let's put back the collar. Milena, you can let go of the stabilization. And Dr. Agarwal, we're going to be ready to start.
Great, let's get on. Let's open this guy up. Let's stop the bleeding.
By doing post-mortem of the simulation, then you can debrief and to go rapidly into that sequence of the event in order to correct or to improve the product at the end.
Guys, I think he's going to make it, okay? Let's go now and debrief. I think we did a great job, but let's go and talk about it, okay?
What we're doing is we're building a simulation ward, so we can actually have a ward with a nurse's station. We can run simulations for how a ward should run, how residents and medical students should be doing ward rounds. Another thing that we're doing is building a simulated apartment. We can train our healthcare providers to actually understand how to manage patients in their own home rather than bringing them straight back to the hospital.
It is very, very important that we use the best and most advanced techniques to produce the next generation of learners, because medicine and medical science change so rapidly that anyone who graduates is going to find themselves as a lifelong learner. And some of the skills that one learns in the Simulation Centre will stand students in good stead as they go forward over their careers.
The Steinberg Centre for Simulation and Interactive Learning is to be a venue for inspiration, evolution and engagement for simulation in all its forms in order to deliver better education for our clinicians, better care for our patients and better health for our community.